Welcome to 5-Minute Video Series. This is Dr. Behzad Elahi from Department of Neurology and Neurosurgery at Loyola Medical Center. Today's topic is Parkinsonism. Parkinsonism has a broad differential diagnosis. Any pathological features that affects extrapyramidal system can cause Parkinsonism. The most common cause of Parkinsonism is idiopathic Parkinson disease, which is defined by degeneration of the substantia nigra, shown in the pictures here, which is the main dopamine producing center in the brain. There are 4 cardinal features for Parkinsonism: tremor, bradykinesia, rigidity, and postural reflex impairment. Tremor in Parkinsonism is usually at rest, but sometimes you can have a postural tremor. The frequency of the resting tremor is usually between 4 and 6 hertz. Although postural tremor can happen in Parkinson's disease, it's not specific and can also be seen in other syndromes. The main assay of diagnosis of Parkinson's disease is bradykinesia, or a slowing, and usually manifests in different ways, including delayed initiation, a slow performance of the task with low amplitude and intermittent arrest of voluntary movements. Rigidity in Parkinson's disease is an increased resistance to passive range of motion, which can be seen in neck or the limbs. Rigidity can present in both flexor and extensors, and different from paratonia, spasticity, or Gegenhalten. The rigidity in Parkinson's disease is not velocity dependent. Postural impairment is usually tested by pulling the patient backward to check for their balance and to evaluate them for rapid threat to their balance. It is not specific to Parkinsonism and can be seen in other neurological conditions that can affect the balance centers, including cerebellar and vestibular systems. You will need 2 of the 3 cardinal features to get the diagnosis of the Parkinson disease that is shown in this picture. Parkinson disease can be caused by a variety of factors. About 5 to 10% of the Parkinson disease are caused by a known genetic mutation, and the remaining of the 90 to 95% are categorized as a sporadic or idiopathic, which is often a combination of genetic and environmental factors. It has been hypothesized that ubiquitin-dependent proteasomal proteolytic system plays a major role in abnormal protein accumulation, which is an alpha-synuclein in Parkinson's disease. This abnormality can be promoted or caused by a variety of toxic processes such as mitochondrial dysfunction or a variety of environmental toxins, genetic mutations affecting alpha-synuclein protein or scavenging systems of the alpha-synuclein protein, and as a result of that will result in cell dysfunction and eventually cell death. In the next few slides, we'll review some of the typical features of Parkinson's disease. On the video on the left, pay attention to this patient's masked face, reduced eye blink rate, and a slightly open mouth, indicating a moderate degree of the masked face. On the right, you see a patient performing finger tapping, opening and closing hands, and pronation supination task, all of them showing mild bradykinesia manifesting as reduced amplitude, fatigue of the movement while the patient is performing the tasks. In these 2 videos, you will see resting tremor in Parkinson patients. On the patient on the left, pay attention to the pill rolling quality of the left hand, as well as the chattering jaw tremor, which are indicative of a resting tremor in a Parkinson patient. The degree of this tremor is classified as moderate. On the right, you see a little bit more severe resting tremor of the Parkinson patients on the right and moderate amount of that tremor on the left. You also see some of that tremor in this patient's legs. Testing a gait is one of the most important exams that can be done for the Parkinson patients. In this video, you see a female with reduced arm swing and stride length on the left side. Please pay attention to the patient's resting tremor while walking. This is one of the hallmarks of the Parkinson disease. Here you can see Hoehn-Yahr, a staging system for Parkinson disease. Although this is not an ideal staging system, it indicates motor progression of the Parkinson disease from stage 1 with symptoms being mild and unilateral to stage 2, symptoms are mild and bilateral, not affecting the patient's walking. Stage 3 with onset of balance issues and compromised balance, but patient still able to walk independently. And stage 4 and 5 resulting in significant disability, difficulty walking independently, and being wheelchair bound and or bed bound at stage 5. Thanks for listening to this video. Next, I recommend reviewing atypical Parkinsonism, medication for Parkinson disease, or video focusing on advanced therapies for Parkinson disease.